Hi, my name is Yasmin Shader, and I am a student nurse at the University of North Carolina at Pembroke. And my service learning project is on flu and the older adults 65 and over. And I hope watching my presentation you learned something of value. And if you have not already gotten that flu shot, that you go out and get that flu shot as soon as possible. So a brief introduction. Flu is a viral infection that is both acute and highly contagious around the world. And the flu virus can have mild to extremely serious symptoms, causing death in some cases. And according to the World Health Organization, they estimate about 5 to 15% of the world population are infected with the flu virus every single year. And there are about 3 to 5 million severe flu cases globally, leading to 1/4 to 500,000 deaths every single year. And last year's flu season, October 2019 to April 2020, the CDC actually estimated 39 million to 56 million people were actually infected by the flu. And out of those people that were infected, 24,000 to 62,000 people actually died. And now these are all estimates because the flu isn't something that is reported on a regular basis. So here's some flu symptoms to look out for. Headache, fever, extreme tiredness, body aches, muscle aches, vomiting, diarrhea, coughing, sore throat, runny or stuffy nose, or just that overall feeling of not feeling well. And if you are experiencing any of these symptoms, you do want to get it checked out early on before it gets serious. Flu and the older adults. Older adults age 65 and above are more susceptible to developing severe flu complications than young people. And that is just all because as you grow older, your immune system weakens. And in developed countries, most influenza-related deaths occur among older adults aged 65 and up. And additionally, 50 to 70% of hospitalizations during the flu season are the older group. So here you can see in my picture the complications that are related to flu, and you can see being older and you contract the flu, your heart attack risk is increased by 3 to 5 times in the first 2 weeks of infection. And look at your stroke risk. Your stroke risk is increased 2 to 3 times, and that's astronomical when you can get that flu shot and that completely decreases. That flu shot helps fight a lot of things. And here we go, 78% of all flu-related hospitalizations are the older crowd. And you have 6 times more deaths from the flu and related complications compared to all the other age groups. Okay, flu vaccinations. Flu vaccinations help people of all ages against the flu virus. And the CDC actually recommends getting the annual seasonal flu shot before the end of October for everyone who's 6 months and older. And the older people, there's specialized shots that actually help that immune system. And here in this picture, you can see, I'm sure you've heard many different flu myths and flu facts. And here's a picture that actually will kind of debunk them if you actually believe one of these myths. So just a few of them. Myth: antibiotics can fight the flu, which that is not true. The antibiotics only fight bacterial infections and not viral infections, and the flu is a viral infection. And the flu is just a bad cold. Yes, the flu may have a lot of symptoms that are similar to the cold, but it is serious and can even be fatal for healthy adults. The importance of the flu vaccination. The flu vaccination may not be the ultimate solution to the flu virus, but every year it is effective in reducing the flu-related hospitalizations and mortality rate. And as you can see here in this chart, you can see the seasonal flu vaccine effectiveness, and you can see the percentage. And also with your flu shot, which is the #1 thing of importance, you also, if you are sick, you're going to want to stay home. You're going to want to avoid contact with people who are sick. If you have to cough or sneeze, you want to cough in a tissue or in your sleeve. And wash your hands. Washing your hands is extremely important. Importance of flu vaccination to older adults. So older adults have a relatively weaker immune system as compared to other age groups, which we've already talked about. Because when you get older, your immune system just weakens. That's just how it is, unfortunately, and you're going to want to take every single step in trying to build it up the best that you can. You're going to want to take care of yourself. So the flu vaccination helps to protect older adults against flu viruses, including influenza virus A, B, and C. So the seasonal flu epidemics are caused by A and B. And A is more serious than B, but B can still cause a severe reaction. C is pretty mild symptoms. The vaccination will help reduce the rates of flu-related medical visits and hospitalizations among the older people. The flu vaccination presents older people with a chance to get vital vaccines such as the pneumococcal vaccine, which protects from brain, bloodstream, lung, and ear infections. And so here's the specialized types of vaccinations that are for the older crowd. So there's a high dose flu vaccine, and this vaccine contains 4 times the antigen than a regular flu shot. And clinical trials actually show that older adults who receive this dose have 24% fewer flu illnesses than regular flu shot receivers. And here's another type, the adjuvanted flu vaccine, and that vaccine is composed of an additive, the MF59, which that just will stimulate your body's immune response, and it strengthens your immune system. And older adults vaccinated using the adjuvanted vaccines show a higher immune response than those who just received a regular flu shot. So that's absolutely amazing. So flu and COVID-19, the symptoms are pretty similar, if not the exact same, and both are going to be highly contagious and transmitted through an airborne route. And they share the initial symptoms such as the cough, the body aches, the fever, the runny stuffy nose, the diarrhea, and more importantly, in being 65 and older, you can have severe complications compared to a different age group. So here at this picture, you can actually see the symptoms for the flu after exposure begins 1 to 4 days versus COVID, which is 1 to 14 days. You can see the causes, the complications, and for flu, the prevention, the flu shot. COVID-19, the prevention is going to be self-isolation, which it can help, but you're not going to want to get the flu and COVID-19 at the same time. That's just not a great combination. So preventing the flu, we're going to have to get that flu shot. So COVID-19 effects are severe for people with weakened immune defense due to pre-existing conditions, which as you get older, you're going to have those pre-existing conditions. It's something that you can't help. It happens with age. And it's going to be worse with people with respiratory illnesses, such as the flu. You're not going to want to get the flu and COVID-19 because once you have that flu, your immune system is already at the bottom and you don't want to get COVID-19 on top of it because that's not going to be a good combination. And lack of vaccination for the older community exposes them to the flu virus, which would weaken their immune systems, making them completely vulnerable to COVID-19. So you're going to want to get those flu shots. So my conclusion, the flu virus once again affects people of all ages, but is more detrimental to the older age group. The CDC recommends getting a flu shot every single year, and older adults are more vulnerable to the flu than the younger adults. And they should be vaccinated with the high dose or the adjuvanted flu vaccine, especially now during the COVID-19 times. And here's my works cited. This is where I found all my information if you would like to go look and learn some more about the flu. This is where I gained all my information. And I hope you go out there and you get that flu shot. I hope you learned something from this. And thank you for watching.